So Ambika, we are live on YouTube also. Nehal sir, good morning.
Good morning.
Good morning. Good morning, sir. Jay sir, good morning.
Good morning, sir. Manoj, sir.
Good morning, sir. Nice to see you. Jay sir, good morning. Thank you for joining in.
Jay, sir. Good morning.
Hello, Manoj and everybody.
Hello,
Good morning,
sir.
How you doing?
All great, sir. Doing good, sir. How are you?
I'm good. I'm good. You know,
Perfect.
it's
Manoj?
8:30 in Las Vegas.
Hello. Hello.
Yes, sir.
Sir, Ambika here, sir. Sir,
Yes,
am I not able to join the webinar?
who's not able to join? Okay.
Myself.
But you are host, right? You should be able to join. I don't know.
Okay, yes, sir. Thank you.
You are a co-host. You have to join, right?
He is the nucleus of this program.
Yeah, exactly.
Yes.
And Dr. J, we have Nehal sir. He is the principal of the institute.
Good morning. Good morning, Jay, sir.
Hello. Good morning.
Good morning.
How you doing? Is that
Fine.
Lakshmi?
No, it's Nehal Shah.
Oh, Nihal Shah, the principal of the
Yeah.
college.
Yes.
Yes, sir.
How you doing, Dr. Shah?
Good morning. Good morning, sir.
Good morning. Here it is evening, actually, 8:30 night
Okay.
in Vegas.
Okay.
I should say good morning to you and thank you for the letter that you sent me, invitation letter. Appreciate it. Thank you for the opportunity.
It's our pleasure, sir.
Excellent, excellent. I'm happy to be here. And we'll be talking some clinical pharmacy topics pretty soon. How is the weather in Gujarat?
It's cold, sir. Presently,
It's cold?
Yeah, it's cold.
What's the temperature?
Around 12 to 14 degrees.
12 to 14 degrees centigrade, right?
Yeah.
Yes, sir.
If you convert that into Fahrenheit, it's probably 80, 90 degree Fahrenheit, maybe, approximately.
Yeah, 36.5 means, yeah.
Something like that, right? Yeah.
Yeah.
Here in Vegas, at night, it goes to 0.
Oh,
Cold temperature. Today, it's better. In the daytime, it was 55, 60 Fahrenheit, which is about, I think, something like 10, maybe 10 degrees centigrade, little less. It's the winter season down in Vegas.
Okay.
Yeah, yeah. So everybody's doing fine today?
Yes, sir.
Okay. What time is the webinar time? Is it 10 o'clock?
10
Your
o'clock,
time?
sir. We'll wait for 1
Okay.
minute, and just after 1 minute we can start. Ambikanan,
Okay, that'll
everything
be
is
great.
fine? Ambikanan,
Yeah.
have you joined?
Yes, sir. Yes, sir. Yes, sir.
You have joined.
Hello.
Ahid, yeah.
Yes, sir.
Manoj, Bangalore has a better weather, right? You got a nice climate in
Yes, sir. We
Bangalore.
have a nice climate. We are blessed to have a nice climate, actually.
Yeah, yeah. I wish I could settle down in Bangalore.
Please do come, sir.
Yeah, yeah. This time when I come over there, I think I should make it a point to visit you in Bangalore.
For sure, sir.
And
Definitely.
probably go to Hyderabad, if possible, some other place if time permits.
No problem, sir. We'll plan together.
Yeah, yeah. Hi, Ambika. Is that the gentleman in ponytail and beard?
Yeah, he's the one.
Yeah, my son looks like you. My son is 21-year-old. He has got a ponytail and a beard and mustache.
Thank you, sir.
Looks nice. Appreciate your organizing this. I'm sure Manoj was of good help, right?
Yes, sir. Yes, sir.
We're expecting people to join.
Yeah,
Yes, sir.
some more.
Okay, no rush.
So Ambika, as a rule, what we'll do is we'll keep everyone mute, okay? And we'll not give unmuting right to all, okay? Only during the Q&A session, whoever raises the hand, we'll give them the unmuting right. So this way we can, continue the presentation properly without disturbance. And during the Q&A session, what I'll do is I'll send you a link, send the participants a link, and they'll ask the questions on the link if they don't want to ask on live. Okay, if they want to ask it live, then perfectly fine. They can just unmute and talk to us. That's always works. And just in case they don't want to ask live, they can always ask via the link, so that we have all the questions in one place and we can keep on answering, rather than, searching for the questions in the chat box. Does that work?
I think it should.
Yeah, I'm just waiting Ambika to respond. I hope it works.
We can start, Ambikanan.
Yes, sir. Sir, we'll wait for 2 minutes.
Okay.
So you got 3 different channels today, I believe, Google Meet, Zoom, and YouTube.
No, sir, it's only we have Zoom and YouTube.
YouTube, okay.
Google Meet was a mistake that, by mistake we had made.
Oh, I got you.
Shall we
I
start?
don't even know how to use that, to be honest with you.
Hello.
Yes, Ambika,
Shall we start?
we can start.
Yes, sir.
Okay. Yes. Nahid.
Hello.
Yes, Nahid.
Good morning. I heartily welcome you all in Pharma Philia Virtual Conference 2022. I, Nahid Sayed, welcome everyone on behalf of Indubhai Patel College of Pharmacy and Research Center and Organizing Committee. I feel privileged to extend my warm welcome to all presented here. Also, I am grateful to Gujarat State Pharmacy Council and our principal, Dr. Nehal J. Shah sir, for giving the grant and permission for organizing such type of event and webinar. Now, I would like to request Lakshmi Kachya, Megha Patel and Nancy Patel for prayer.
आ जाओ के सब मिल के रब से दुआ मांगे, जीवन में सुकून चाहे, चाहत में वफा मांगे, हालात बदलने में अब देर न हो मालिक, जो देख चुके फिर अंधेर न हो मालिक, एक तू ही भरोसा, एक तू ही सहारा, इस तेरे जहां में नहीं कोई हमारा, एक तू ही भरोसा, एक तू ही सहारा, इस तेरे जहां में नहीं कोई हमारा, हे ईश्वर या अल्लाह, हे पुकार सुन ले, हे ईश्वर या अल्लाह, हे दाता, हे ईश्वर या अल्लाह, हे पुकार सुन ले, हे ईश्वर या अल्लाह, हे दाता, हमसे न देखा जाए बर्बादियों का समा, उजड़ी हुई बस्ती में ये तड़प रहे इंसान, हमसे न देखा जाए बर्बादियों का समा, उजड़ी हुई बस्ती में ये तड़प रहे इंसान, नन्हे जिस्मों के टुकड़े लिए खड़ी एक माँ, बारूद के धुएं में तू ही बोले जाए कहाँ, एक तू ही भरोसा, एक तू ही सहारा, इस तेरे जहां में नहीं कोई हमारा, हे ईश्वर या अल्लाह, ये पुकार सुन ले, हे ईश्वर या अल्लाह, हे दाता, हे ईश्वर या अल्लाह, ये पुकार सुन ले, हे ईश्वर या अल्लाह, हे दाता, नादा है हम तो मालिक, क्यों दी हमें सजा, क्या है सभी के दिल में नफरत का जहर भरा, नादा है हम तो मालिक, क्यों दी हमें सजा, क्या है सभी के दिल में नफरत का जहर भरा, इन्हें फिर से याद दिला दे सबक वही प्यार का, बन जाए गुलशन फिर से कांटों भरी दुनिया, एक तू ही भरोसा, एक तू ही सहारा, इस तेरे जहां में नहीं कोई हमारा, हे ईश्वर या अल्लाह, ये पुकार सुन ले, हे ईश्वर या अल्लाह, हे दाता, हे ईश्वर या अल्लाह, ये पुकार सुन ले, हे ईश्वर या अल्लाह, हे दाता, हे ईश्वर या अल्लाह, हे दाता, थैंक यू।
Wonderful. Thank you so much.
Thank you, Lakshmi Kachya, Megha Patel, and Nancy Patel. I would like to invite Dr. Nehal Shah sir for introduce today's eminent speaker, Dr. J. Pillai sir.
Thank you. Good morning. Good evening, sir. Jai Pillai sir. Good evening. Good morning to Dr. Manoj Kumar sir and faculties, and the delegates who have joined through this virtual platform. Good morning to one and all. So this pandemic situation has really helped in another way, that today we are virtually present all over here. Now distance is not a matter now, because you are from far place, from New York, you are over here, and sir is from Bangalore. So to gather offline, it would have not been possible, but this is the wonderful thing which pandemic situation has given the opportunity to be present on this platform. Sir, we are located at Gujarat, in Anand district, sir, Milk City, and which is 30 kilometers from Anand, sir, in the Charotar region, sir. And it is at Dharmaj. Dharmaj is considered as Asia's richest village, sir.
Wow.
Every one member are NRI from one house in Dharmaj. So our main aim and objective to start pharmacy college in 2006, we have started pharmacy college to provide the education to the Charotar vicinity of the area of the poor people. Then in 2017, we have started with Pharm D course also. We are running M-Pharm courses in 2 subjects, pharmaceutics and quality assurance. And this is the event, Pharma Philia, which has been organized by Ambikanand Jha, who is Pharm D 5th year student, who is the volunteer, who is the nucleus, as you said, of this event. So as Indubhai Patel College of Pharmacy and Research Center at Dharmaj, so it's my pleasure to introduce you and heartily welcome you, both Dr. Manoj Kumar sir and Dr. Jai Pillai sir, on this virtual platform. Let me introduce Jai Pillai sir, who is having an experience of over 25 years in various facets of pharmacy professions: hospital, clinical pharmacy, community, compounding, and teaching. Sir is currently specializing in clinical pharmacy practice in a teaching community hospital, drug therapy optimization, intervention based on evidence-based medicines, pharmacokinetic dosing, monitoring of antibiotic therapy, and medications with narrow therapeutic indices, IV admixtures, total parenteral nutrition, and chemotherapy. Sir has technical and trained Pharm D students in advanced clinical pharmacy practice and medical students on neonatal drug therapy, counseling and educating patients on discharge medications and anticoagulations therapy, compounding skills in sterile and non-sterile formula adhering to FDA and USP regulations. Sir is having vast experience starting from 2005 to 2021, means still he is working with clinical pharmacy Dignity Health at Henderson's, Nevada, clinical pharmacist Mike O'Callaghan Hospital, Las Vegas, from 2003 to 2005. From 1993 to 2003 as a counseling pharmacist, Merck McDo, Las Vegas, and as pharmacy supervisors from 1992 to 1993. From 1992 to 1987 as pharmacist, Holy Cross Hospital, Maryland. From 1983 to 1987 at Graduate Teaching Association, Long Island University, New York. Sir has also having experience from 1980 to 83 as pharmacy manager in NMC Hospital at Abu Dhabi, UAE. Sir has been lecturer in pharmacy college also in India, that to KMC University, Manipal, from 1976 to 1980. And he has taught dispensing pharmacy, pharmaceutics, and pharmacognosy to pharmacy students. Today we are having same subjects as pharmacist. Sir is Pharm D from College of Pharmacy, from MS Pharmaceutics from Long Island University, New York, and he is B.Pharm from India, that is Madurai Medical College, Madurai, India. And he has secured first rank in B.Pharm. Sir has a lot of professional affiliations, certifications, and license. And he is having skill with computer, and he has 4 papers in his credit. So with this short introduction, I would heartily welcome you on this virtual platform, sir, to be over here as a part of Indubhai Patel College of Pharmacy and Research Center family. We used to organize such kind of webinars to make aware with the present scenario of clinical pharmacy and Pharm D, where the students of Pharm D and B.Pharm students can get benefit with outcome of this seminars. So thanking you once again to be over here on this platform, virtual platform. Thanking you. Thanks from one and all from my side. Thank you, sir.
Should I begin?
Nahid? Nahid?
Yes, sir.
Nahid? Yeah, I have completed. It's over to you. Nahid? Nahid?
Might having some network issues, sir. Now I would like to invite Dr. Jai Pillai, sir, for the presentation.
Dr. J, you are already a co-host, so please, you can start.
I can start now?
Yes, sir.
Okay.
Thank you.
Okay. Okay. I was just waiting to give me a green light. Thank you so much, Dr. Shah, for the short but introduction in a chronological order that gave me all my secrets in the background with a long experience, and everybody knows now I'm an older guy. Thank you so much. Appreciate it. Introduction was generous, and the prayer song was excellent. Although it was sung in Hindi, I was able to pick up a few words. I used to speak a little bit Urdu when I was in Abu Dhabi, pretty much same as Hindi. So that was wonderful song. It's a good start. Before I begin, I should probably mention, if I don't, that would be an absolute remiss. That would be Manoj Kumar Yadava, my LinkedIn buddy. He actually introduced me to your institution through Ambika Nanja. And I believe he talked to Dr. Shah and got the permission, and he made this webinar happen. I must thank all of you and also every participant to take part in this webinar on a Saturday morning. And it is here Friday. Is it Friday?
In India, it's Friday, sir.
You have Friday and I have Thursday night down here. I don't even know what day and which day. In any case, appreciate your coming in and listening to me. Hopefully it'll be a useful seminar for you. And I would like to begin now. Is that okay with all of you?
Please, sir. So you got to click on the button, play button. Button.
Yeah, that's what I'm doing.
Little up on the button, sir.
Yeah.
Up. The triangle.
For some reason.
No, the play triangle. Not the text, the triangle.
Where is the triangle?
So ever play text, there is a triangle, right?
Yeah, there is a play here.
Yeah, above that, that icon. You have to click on the icon. Play icon.
Play icon. Yeah, I'm clicking it. It's not doing it.
No, no, no. You have to click on the icon, sir, the triangle icon above the play text. You have rehearse and play, right? So there is a play button and then there is a text. So you have to click on the button.
Yeah, I'm clicking it. It's not coming through here for some reason.
Maybe you close it and then try one more time.
Yeah, here it is. Here we go.
Yeah.
You guys are able to see my screen?
It's still it's not come in the full screen mode.
Okay, let's see. Resume share.
Please try closing and opening one more time, sir.
Okay. Is it on full screen now?
No, no. You close the sharing option and then open the full screen option from the share button.
Stop share.
Click on the share button now and click on the full screen share option. Yeah, perfect.
Is it good?
Yeah, it's good, sir. Perfect. Yeah.
Okay, thank you so much. And you are all able to hear me properly? Everything is good, ready to go. Okay. Yeah, thank you so much again. There are some screen that keeps coming up. Admit, people are waiting. Admit, it keeps popping up on my screen.
I'll take care of that, sir. You don't worry about it.
Very good, very good, excellent. And yeah, today's topic is going to be clinical review of physician's prescription prior to dispensing. This is one of the basic and primary role of any clinical pharmacist. And I thought I will speak about this. It'll be a useful topic, particularly when the clinical pharmacists go into hospital setup or community pharmacy setup. This is going to give you some idea as to how to look at the prescription, screen it, make sure it is properly dispensed. And we will go through the process in a second. Just to be clear, my first name is actually Jayachandran Pillai. When I came to this country, my professor in Long Island University asked me, "Hey, Mr. Pillai, how do you pronounce your first name?" I said, Jayachandran, very easy. Not for me, Mr. Pillai. Would you mind condensing it to the first three letters, J, so that everybody will be able to pronounce it uniformly? Because J is quite a few famous name here, common name in the US. I said, why not? Not a problem at all. And that's how my first name became J Pillai. And I got, few degrees and titles. And your YouTube flyer has Dr. J Pillai and all that. If you don't mind, feel free to call me, just J, first name. That'll be good enough. No need to title me with the doctor and forget about my degrees. I want to be very casual and informal. I would prefer that. As long as you guys are comfortable doing that, that's okay with me. Let's dive into the topic directly. The objectives of the webinar today is the following bullet points. And I would be briefly discussing about types of medication errors. There are 4 major medication errors, but I will be particularly focusing on the prescribing errors coming from the prescriptions from the physicians. And I would suggest some guidelines that we follow in the US that you might want to implement when you get into practice. It may or may not be applicable in practical terms, but these are the guidelines that we follow in the US. And I'm going to be discussing very briefly about the pathophysiology, the disease progression or the pathogenesis of the disease, urinary tract infection, abbreviated UTI. This is our bread and butter. We have to be familiar with the pathophysiology of the disease. Then only we will be able to assess the appropriate medication therapy for that particular disease. And why I selected UTI, it is a very common infection that occurs in the community, predominantly in female population. And I'm going to give you a couple of examples. One is an outpatient community pharmacy prescription for a patient with this condition, UTI, and also a same condition, different patient in a hospital setting, so that we can compare and contrast how do we approach dispensing prescription in a community drugstore and also in a hospital setting. And I will be briefly talking about the communication skills that we as a clinical pharmacist should develop when we try to communicate with healthcare providers, particularly physicians, which is going to be a little tough task. But when we practice these skills, we might be able to get through and get the job done. And finally, we will end up with a Q&A discussion. Okay, types of medication errors. Broadly, the medication errors are classified into 4 different types. The first one is the prescribing errors, 46.5%. It could be more or less in India, probably more, because I'm not sure the prescriptions are reviewed at the drugstore level. Mostly in the hospitals, maybe it'll be looked at a little more in detail before they dispense it, but community, I'm not so sure of that. And then the dispensing errors. Dispensing errors are 14%, which is the least of all these medication errors. This comes from us, the clinical pharmacists. Although it is less, it is 14%. This applies to the data that comes from the US. So that's what I'm talking about. And the third one is the transcribing error. Transcribing error comes from when the physician phones in a prescription. The nurse or anyone else in the department in a hospital setup, they take the prescription and then they put it in the computer. In the process, they either mistype it or they take it for some other drug. For example, in the US, there was a drug called Losec, L-O-S-C, Losec, which is the brand name for the omeprazole. You might be familiar with that. And also there is a drug called Lasix, which is a water pill, diuretic, furosemide. And when the doctor give the prescription over the phone for Lasix, the nurse thought it was Losec. And the strength happens to be the same, 20 milligrams. So the Losec was transcribed into the system when the doctor was intending to give a Lasix prescription. This is a transcribing error. It actually happened. And that's why the company changed the name from Losec to Prilosec to make a differentiation. And then finally comes the administration error. This is mostly in the hospital setup. Nurses gives the medication to the wrong patient. They give the wrong dose. Sometimes they administer through incorrect route of administration, so on and so forth. So that's about 29%. So in this process of medication error screening, if we pay attention, as a clinical pharmacist on the prescribing error, when the prescription comes to you, you will be able to reduce those 46% errors to the minimum, and your dispensing error in turn will go down to single digit. So that's the point of looking into the prescription and do a clinical review, which I'll be talking about in the next slide. How to review a prescription. First of all, when the prescription comes to you, you should be able to know from the prescription by talking to the patient, maybe even by talking to the clinic, the indication for the drug. Indication is the use of the drug. If an antibiotic is prescribed, you got to make sure the patient has an infection, particularly bacterial infection, not viral infection. So you got to identify the prescription has an indication. Not only we have to know the indication, the medication prescribed is appropriate for that particular indication. For example, if you get a prescription for levaquin, levofloxacin, a fluoroquinolone antibiotic, you should be able to collect the information that the patient does have an infection. Patient has otitis media, infection in the ear. There is an antibiotic, there is an infection. Is the levofloxacin is appropriate for otitis media? Probably not. There are different antibiotics that are just available that will target that particular indication. When we go through the prescription, you'll be able to get the idea. And also, we got to know, is the dosage is correct? When the levofloxacin is prescribed, you're looking at the prescription, the doctor writes levofloxacin 250 milligram twice a day. Is that a normal dosage? Dosage is correct, 250 milligram to 500 milligram. That's the dose. But is the directions are correct? It's not. Levofloxacin is prescribed once daily. Because of its long half-life, it's given once daily. The doctor is probably thinking about ciprofloxacin, which is prescribed twice a day. So you should be able to observe that and correct the dosage by calling the doctor's office. That's what we do here. But some of the things that I'm talking about may not be applicable, but bear with me. This process is the common practicing points. This process is very common here and in some of the countries in Western side, maybe in UK and other countries. And we are going to be slowly introducing all these through you guys, clinical pharmacists in a community practice, in a hospital setup, as the years go by. Hopefully, it'll all take place pretty soon. And then we should be able to identify if there are multiple prescriptions on the prescription pad. We should be able to identify any clinically significant drug-drug interaction. For example, a patient comes with a prescription with two medications on it, diltiazem and digoxin. He is a patient with hypertension, and also he needs digoxin to reduce his heart rate, to strengthen his heart rate. Digoxin is cardiotonic, diltiazem is anti-hypertensive. But there is a drug interaction that takes place between diltiazem and digoxin. What happens when they take this drug, the diltiazem kind of interferes with the elimination of the digoxin. In the process, the digoxin level goes up in the body. And digoxin, as you know, has a narrow therapeutic index. What happens if the digoxin goes above the range? It's a toxic level. You would have all learned in pharmacology, digoxin toxicity. So it doesn't mean these two drugs should not be given. It could still be given. Here, what we need to address is that the patient's digoxin level needs to be monitored. If the levels keeps creeping up, then you got to reduce the dose of the digoxin and make sure it is within the therapeutic range. And also, if there is any clinically significant drug-disease interaction, we should be able to identify that. For example, if the patient brings in a prescription for propranolol, Inderol, which is a non-selective beta blocker, and you have filled a prescription for this patient in the previous occasion, inhaler albuterol for asthma. This is the patient with asthma, bringing a prescription, a new prescription for his blood pressure, high blood pressure, non-selective, selective beta blocker. I'm sorry, the Inderol is a non-selective beta blocker. And what happens when you give this drug for a patient with asthma, the Inderol is going to worsen the condition of asthma because it is non-selective. It is not only going to block the beta-1 receptor, it will also block the beta-2 receptor. When you block the beta-2 receptors, it's going to induce more asthma because albuterol is the beta-2 agonist, helps dilate the lungs. So in this situation, when you identify this drug-disease interaction, you should be able to speak to the physician and change it to a selective beta blocker like atenolol. Atenolol is a selective beta blocker. It'll block primarily the beta-1 receptors, and it is not going to mess with the beta-2 receptors. And also, is there unnecessary duplication with other drugs? This actually happened to my sister when I was in India. She was asking me to review all the medication. And she showed me two different strips. One was the, I believe, nifedipine, and the other one was amlodipine. Nifedipine and amlodipine, they are calcium channel blockers. There are two calcium channel blockers because she has gone to two different doctors. One doctor prescribed the nifedipine for blood pressure. The other doctor prescribed amlodipine. I told her, this is the duplication. You should not be taking these two. And she was all swollen up. She has edema, water retention in the body. Why? It is because of the side effect from two calcium channel blockers. So I told her to stop one, and I told her to take only the amlodipine. And also I told her to speak to the doctor because the two different doctors, of course. The second doctor should have checked and asked the patient what medication you are taking. Then the doctor should have prescribed another drug as opposed to the calcium channel blockers. And finally, is the duration of the therapy is acceptable? If the doctor prescribed an antibiotic particularly, antibiotics are given for a certain duration, usually 5 to 10 days. Most of the infection clears up in 5 to 10 days. It doesn't have to be 2 weeks unless there are some reasons for that. Usually 5 to 10 days. If you see an antibiotic prescription, it must have the duration 5 days or 7 days. The duration has to be indicated. And finally, not the least, but it is also important to make sure that the drug that you're dispensing is also least expensive, because everybody is not rich, particularly in India. The affordability is not there. So we got to make sure if the doctor prescribes an expensive antibiotic, levofloxacin, Cipro for UTI, we should be able to recommend some alternative, which is inexpensive, so that the patient will be able to afford. So these are some of the guidelines I am giving it to you. that we definitely follow here. And it would be nice if you could implement a system that every prescription comes out of the physician, goes through this process in India for the betterment of the people and a better healthcare outcome. And I'm going to briefly talk about the pathogenesis, the pathophysiology of the UTI before we get into the patient example. If you look at the picture on the right-hand side, the urogenital system or genitourinary system consists of kidney, ureter, bladder, and the urethra, right? So the pathogenesis, how does the disease occur in a patient? How does the UTI come about in a patient? These are the 4 different parts of the genitourinary system involved in the UTI. Normally, urinary tract is sterile, normally. And urinary tract has some defense mechanism built in the body. One is complete emptying. When the bladder is full, we empty completely. So if there is any organism, it comes out, so infection is cleared. And urine also has the property of acidity. And the acidic nature kills the organisms as well. And the ureter and also the whole urinary tract system has vesico-uretral valve built in it. So urine flows in one direction from the top to the bottom and comes to the bladder. It does not let the urine go back. If it goes back, then there is another issue called reflux of the urine. And also the system has immunological and mucosal barriers. And these 4 different mechanisms keep the urinary tract normally sterile. And 95% of the UTI happens by the ascension of the bacteria from the urethra to the bladder. Here is the urethra at the bottom. And the bacteria, usually E. coli from the gut, when it comes from the perineal area, from the rectum, it gains entry into the urethra. This is because of the cleaning method that we follow, particularly in the female. When you clean, the cleaning has to occur from the front to the back, not from the back to the front. When the cleaning procedure occurs, when anybody follows cleaning from the rectal area to the front, that brings the E. coli, and E. coli gains entry into the urethra. And the female gets about 80 to 90% of the UTI because of this, of their anatomy of the urinary tract and the system. Men has a different anatomy, has got less chance of getting the UTI. And 5% of the UTI are pyelonephritis, and also they are spread by hematogenous through the bloodstream, nosocomial, the infection that they get from the hospital, and also through systemic bacteria. When the systemic bacteria from the bloodstream circulates through the kidney and the urogenitary system, then the E. coli comes in and infect the whole system. So as long as the bacteria is located in the bladder and we empty it, it's not a problem. You don't even need a treatment infection. All it requires is a complete emptying. But in some cases, the person does not empty the bladder for some reason, maybe some urinary obstruction or some other abnormality in the system. So urine stays here stagnant and the bacteria growth occurs, and the bacteria ascends through the ureter, goes into the kidney, from the bladder to the kidney. So when it goes from the urethra to the upper part of the urinary system, it becomes a complicated UTI. As long as the infection stays within the bladder, it's an uncomplicated UTI, easy to treat. And when the infection goes to the kidney suffers, the nephrons deteriorates, and then it leads to AKI, acute kidney injury. But here we are going to talk about two patients with uncomplicated UTI, which is primarily located in the lower part of the urinary systems. It's also called as cystitis, other name for that, and also they call that lower urinary tract infection. That's what we are going to talk about in this patient example. Okay, here is the prescription, just a make-believe prescription from Dr. Jha's clinic in Dharmaj. The patient is Miss Sunshine, a lady, goes to Dr. Jha, and Dr. Jha diagnosed the patient has an UTI. It's an uncomplicated UTI because of the symptom description and everything else, which I will talk about in the hospital set of patients. The doctor has diagnosed this patient as having uncomplicated UTI and give a prescription for amoxicillin 500 milligram, Q6 hours with no refills. And also at the same time, she is a young lady, 28, recently married, and getting a prescription for the birth control pill, low estrogen once a day, day 1 to 28 with 11 refills. When you look at this prescription, I identify immediately, because I've seen this a couple of times, two issues. One, let's review the prescription based on the clinical review bullet points that we reviewed just now. Before getting to that, I think Manoj recommended that I explain the parts of the prescription that might be useful for some of the new students as to what the prescription, different parts of the prescription means. For example, the first part is the physician's address. And the second part is the patient's name, allergy information, age, and the address. And the third part is the RX. RX stands for recipe, the formula. It's also called as superscription. And in the middle part, which is the main part of the prescription, is the inscription and the subscription. Inscription is simply the name of the drug and the strength, and the subscription is the quantity. And finally, you have the doctor's signature, date, and everything else at the bottom. These are the main 5 parts of the prescription, just to give you a simple narration of the prescription pad. Of course, I have not seen a prescription myself in the hospital. It's all computerized, it's entered, so we go through the computer and make sure it is dispensed properly. But if I work in a community pharmacy also get the prescription, majority of the prescription comes through online from the doctor's office to the pharmacy. Sometimes patients do bring in paper prescription, similar to this one. And now we discussed some of the important criteria that you have to follow before you review this prescription. This prescription should be reviewed based on these bullet points that we discussed in detail: indication, effectiveness, dosage, direction, drug interaction, drug disease interaction, any duplications, duration, and cost effectiveness. when you look at that, of course, by talking to the lady, she said, I have a urinary tract infection. When I urinate, I got difficulty urinating. It's burning sensation. I got some back pain and all that. So you gather the information. So UTI is fine, and amoxicillin does work for UTI. But if you look at the direction, it is Q6 hours. For a patient of 28-year-old, 500 milligram is good, but amoxicillin is normally prescribed every 8 hours, not every 6 hours. And also there is no duration of the therapy. If it is an antibiotic, doctor is supposed to give the duration. So that's missing. So two, one is the direction, Q6, and there's no quantity. And also I notice there's an interaction between amoxicillin and a birth control pill. What happens when a patient takes amoxicillin and a birth control pill, there is a drug interaction. The birth control pill interferes with the efficacy of the antibiotic. So that's the issue here, drug interactions. So what's the solution here? You got to call the doctor and speak to the doctor, which apparently we have done that, make believe that we have done it. Talk to Dr. Jaw's clinic. He is very receptive to clinical pharmacist recommendations and suggestions. He took your advice and allowed you to change the direction to every 8 hours. And also you recommended for 5 days. And that's how the treatment should be. For uncomplicated UTI, if you give for 5 days therapy, that's good enough. Doesn't have to be 10 days, doesn't have to be 14 days. And sometimes you might see those prescriptions. So you have to look into that to make sure if it is an uncomplicated UTI, this is the duration of the therapy. And also you counsel the patient, explain the patient, ma'am, this would interfere with the efficacy of the antibiotic. So what you need to do is preferably abstain from any romantic interlude with your husband until 5 days, and then give it another few days. Or you have to use a condom or something, additional forms of birth control measures so that the antibiotic is effective. And also the antibiotic may interfere with the low estrogen as well to make the birth control pill ineffective. So this might cause unwanted pregnancy. If the lady is not planning for pregnancy, and this would lead to an unwanted pregnancy as well. These are some of the issues that we identified and rectified in this prescription. Is there any questions, or I'm speaking too fast or slow? Any suggestions before I proceed further?
So participants, this is for you. Dr. J wants to know if this is so far it's clear. Any questions? Type CLR if it is clear. In the chat box, type CLR if it is clear. Okay, Amulya says clear. Vrishti, Divya, Inshia, all of them, they say clear. Anyways, I have given the form for asking the question. So you may start filling in the form question, with your specific question. We'll take up the questions during the Q&A session.
Excellent. Yeah. Thank you, Manoj.
My pleasure.
Appreciate that. So if you have any question, jot it down and put it in the chat box. We can discuss it.
Not in the chat box. There is a link which I have sent on both YouTube and Zoom link. Zoom
okay.
So please ask the questions directly from the question via the link, so that we'll have all the questions in one place.
Very good. Very good. Thank you, Manoj. And here is the patient that I reviewed in a hospital setting. Mrs. GM is a 70-year-old female weighing 58 kilograms, 64 inches, is admitted for complaint of supratherapeutic pain dysuria, and urinary frequency. So the letters in yellow color tells me that this is an uncomplicated UTI because she had dysuria, she has urinary frequency, and also supratherapeutic pain. So this is a typical symptoms of uncomplicated UTI. She is allergic to penicillin and codeine, and her past medical history, PMH, past medical history. I have abbreviated that for the sake of limited real estate on my screen. Her previous medical history is hypertension, diabetes, hypercholesterolemia, ventricular arrhythmia, and osteoporosis. And her current medications are aspirin, 81 milligrams. When you look at the list of medications, you should be able to identify what each drug is playing a role. Aspirin, enteric-coated 81 milligram once daily. I just put in the indications for those drugs. It doesn't come that way in the computer. Just for the sake of explanation, I'm putting it here. She's taking aspirin as an antiplatelet, as a blood thinner. Why? Because she has got ventricular arrhythmia, which can lead to blood clots. And for hypertension, she is taking losartan, 50 milligram, and hydrochlorothiazide combination once daily for hypertension and diuresis. She's also taking atenolol, 25 milligram once daily for hypertension and rate control, amiodarone for rhythm control, ventricular arrhythmia, just to contain the rhythm. Amiodarone plays a role, and to control the rate, the atenolol plays a role. Metformin, 500 milligram, extended release once daily with glipizide, 2.5 milligram once daily for diabetes, because she has diabetes. And pravastatin, 40 milligram at bedtime for cholesterol control. She has hypercholesterolemia. And acetaminophen, 500 milligram 3 times a day for osteoarthritis. I'm sorry, I said osteoporosis. It is osteoarthritis. And multivitamin with minerals once daily for vitamin and mineral supplement. Cyclobenzaprine, 5 milligram at bedtime is needed for muscle spasm. And alprazolam, 0.25 milligram at bedtime for insomnia. And also I'm taking a look at her labs, culture, and sensitivity. When you look at the labs, the CBC, the complete blood count, and the electrolytes like sodium, potassium, calcium, magnesium, they were all within normal limits. I'm just abbreviating for the sake of space in my screen. And her vitals, blood pressure is 115/75, which is normal. Heart rate is 77, which is normal. And temperature, afebrile. She doesn't have any fever. So that also gives me a clue that the patient's UTI is uncomplicated. The complicated UTI usually results in fever. And WBC, white blood count, is 9.5, is slightly elevated, and respiratory rate is 16 beats per minute. Her kidney function is reflected by the serum creatinine, which is 1.1, a little bit elevated. Of course, her age is 70-year-old, and the creatinine clearance tells me her kidney function, how efficient it's functioning. It's 40 to 45 mils per minute. The normal creatinine clearance for youngsters like you all, it should be 90 to 100, and she has half the clearance. Usually when we get old, over 60 and 65, our kidney function naturally decline, coming to 50% and 60%. Her urine is slightly hazy. The haziness indicates she has bacterial growth. And dipstick is positive. That also indicates there's an infection. And the culture, urinary culture, shows E. coli is growing at this concentration, colony forming unit, 100,000 per ml. which means there is a lot of growth going on in the urine. If the colony forming units is something like 10 or 15, you don't even have to treat that patient, because just by drinking a lot of water and complete emptying of the bladder, the infection is going to go away. And the culture sensitivity tells me that E. coli is sensitive to levofloxacin and the sulfur drug and amoxicillin. We noticed the patient has penicillin allergy, so we cannot choose amoxicillin for this patient. And the doctor also did a kidney ultrasound to make sure there is no kidney obstruction, there is no kidney stone, or there is no abnormality in the kidney structure, just to rule out it is not a complicated UTI. So that helps the doctor to decide whether it is a complicated UTI or an uncomplicated UTI. So obviously, from this information, we can conclude that this is an uncomplicated UTI. And the doctor prescribed ciprofloxacin, 500 milligram BID for 10 days. By looking at it, of course, the E. coli is going to be sensitive to ciprofloxacin 500 milligram BID. The dosing is okay. He looked at levofloxacin, but he was familiar with the same family, ciprofloxacin, so he chose the highest dose, 500 milligram BID for 10 days. So I was looking at this prescription. By looking at the patient's information, the lady is 70-year-old, and her kidney function is half the normal function, 40 to 45 mils per minute. For this patient, the dose of the ciprofloxacin should be 250 milligram once daily, not 500 milligram twice a day. So that prescription, although it's the right antibiotic, the dose is not appropriate and the duration is not appropriate. Usually uncomplicated UTI treated with cipro should be given for 3 days, not 10 days. So these issues need to be discussed with the doctor. So what we did, we have to speak to the doctor just to make sure we provide the right information. We got to have some communication skills with the prescriber. When I came to this country, I was not very good in communicating with the doctors down here. I have encountered some doctors who were obnoxious. And because I'm new, I didn't know how to approach, how to begin the conversation, how to provide the information. So these are some of the points that helped me along the way in refining my communication skill, establish a congenial and collaborative relationship. To begin with, we got to establish a relationship. Maybe we have to have a conversation with the hospital physician first through the pharmacy department and have an understanding that we have a clinical pharmacist and we will be reviewing all the prescriptions and we will be making recommendations. A collaboration is necessary before we proceed by implementing this process. And we got to display a professional look and a friendly demeanor. When we go to the doctor, our appearance is very important. Preferably with a nice clean dress, not with multicolored t-shirt. That wouldn't project a professional image with a white coat. And also we have to display a good, friendly demeanor. Not only that, we got to exude confidence. When we approach the doctor, we got to look confident and we got to project a competence at the same time with humility, because some people express their confidence and competence that may be misconstrued as an arrogance. Oh, this guy is coming with a big head. What's the matter with him? So that should not be the case. We have to practice to express confidence, competence with humility, which is important. And when we provide information, we got to be informative and suggestive. And the information that we are giving has to be concise and respectful. How do we provide correct information? We have to provide based on some reference. Hello, doctor. I'm just looking at your patient's prescription. Before I dispense Cipro, I would like to recommend a different antibiotic based on this evidence-based reference. So you can quote that. This patient is 7 years old. Her creatine clearance has been compromised, which is 40 to 45 ml per minute. And according to this reference, lexicon or any reference that you use, the drug recommended for this uncomplicated UTI, we recommend this drug, this dose. That is what we recommend. We are not going to say you have written a wrong prescription, which is not correct, and it is not appropriate. We have to say, this is a recommendation. This antibiotic is appropriate for this lady, because you have seen the lady's information. You provide that you know as much information as the doctor knows. That way, we will be able to provide the information in a way that he'll be able to listen and likely accept our recommendation. Some of the doctors, may argue, no, I have used Cipro for many years. It works wonders. He would say that, he would argue with you. So you have to listen to the doctor. You have to practice active listening. Active listening means you have to look at his eyes, and you have got to nod, and you have to project a feeling that you're really listening to him with an open mind. The problem with Cipro is that when it is prescribed indiscriminately, Cipro can cause tendinitis, inflammation of the tendons. Cipro can cause C. diff, Clostridium difficile infection in the stomach, because it can kill the good bacteria, the commensals in the stomach. Now the Cipro is implicated in causing QT prolongation. Some of you would have gone through the cardiology. QT prolongation is a dangerous arrhythmia. You may probably Google it and read more about QT prolongation. And these are all situations where it can put an elderly patient in a dangerous situations. You have to explain that in a way that he listens. And finally, in a way, you make small interventions and successes to build on it, and we go from there. Regardless of the physician acceptance, do thank the physician. Here, that's what we do. If he disagrees with our recommendation, he wants to stick to what he prescribed, then we will still thank the physician, but we will document in the computer that these are the recommendations made, doctor declined. Because down the road, if there is a complication, if there is a question as to why this happened, so we have the explanation on record so that we have done our job and it was not taken by the physician who prescribed the drug. And then we use this process, and the prescription for Cipro 500 BID orally for 10 days has been changed to Bactrim DS, 1 tablet twice a day for 3 days. Where did I get this information? See, such a simple prescription. It's not only an inexpensive drug, it is given only for 3 days. It clears the infection when it is given twice daily for 3 days. This information, I picked it up from Lexicon. I would like to show you the location of this information. Maybe when we have the Q&A session, I'll go in there. I don't want to mess up my screen now, then come back, then I will have difficulty. I'm not too good on techie like Manoj and Ambika. So this is the recommendation. Doctor accepted it. The drug was changed. And it's the least expensive drug, effective drug. Patient got it, infection cleared, patient went home happily. Take home points. This is the final slide. I think I take more time than I should have. Apologize for that. So what you need to do, these are all the things you have to remember as the take home points. Every prescription order requires a clinical review, no matter what. That's what we do it here. May not happen in India, but this is what's supposed to happen. Dispense only when all the safety criteria are met. As we went through the bullet points, try to go through the checklist. When it is all met, then we dispense it. Here in this country, US, pharmacists have the right not to dispense a prescription because it can endanger the patient. So we do follow that procedure in certain cases. Contact the prescriber to clarify inconsistencies like dosing, directions, number of days, etc. When in doubt, call for clarification. Be professional, polite, informative, and concise with the physicians because physicians are the captain of the ship. So we have got to deal with them in a manner that our clinical pharmacy practice, particularly in India, pick up some space and it is being accepted in due course of time. Document the outcome of our conversation, regardless whether the patient accepted it, whether the physician took it or not, because the patient's safety is our primary goal. The patient could be me, it could be you, or it could be your parents or relatives, it could be your friends, it could be anybody for that matter. Patient deserves the best healthcare possible because healthcare is a basic human right. And that completes my presentation. Appreciate you all listening to that. And if I have expressed any kind of, I don't know, some slangs, having been here for America for so many years, if I made some cryptic comments, I apologize. Feel free to express it in the form of questions or comments. I'll be happy to answer. Thank you so much.
Thank you so much, sir. Nehal, sir, over to you. You're on mute, sir. Nehal, sir. Nehal, sir, you're on mute.
Dr. Shah, you might want to unmute yourself.
Yes, I might having his mic is mute. An option. Now, over to you, Nahid.
Ambika, I think Dr. Shah is trying to say something, but he's on mute. Okay.
Might having some network issues.
Okay, right. So go on. Ambika?
Yes, sir. Yes, sir.
You want to take the quiz now? You want to circulate the quiz now?
Yes, sir. Nahid, over to you. 1 second, sir.
Yes. And this is for all the part. Dr. J, you could please close the screen share.
Okay.
Yeah. And this is all for all the participants. So we have already shared the link, a link to asking the questions. If you have any questions for Dr. J, please use that link and ask the questions, and we'll pick up the questions at Q&A time.
Thank you, sir. Thank you so much for giving some labor insight on medical review of physician's prescription dispensing. Now, in the comment section, I will send a quiz link.
Okay, so participants, there is a link in the quiz chat box. You can use this and respond. There is a time limit for this. It's for 10 minutes. And after that, we'll continue with next session.
I think Dr. Shah was unable to unmute.
That's what I was also trying. I don't know. Let me just check what is happening. Dr. Shah, you please try to unmute now. Try to unmute now, sir.
Yeah, now it's okay, sir.
Now it's
I
clear.
was
Now I
unable to
can hear
unmute
you.
because the power was with you, so that was I was trying to say.
I'm so sorry. I'm so sorry. I'm
No,
just
no issue, no
making
issue.
you. I'm just making you the co-host
Hmm.
right now. Yes, you are.
Anyhow, it was really a good presentation, Dr. Jai, sir, and it was really informative because I am also in touch with this topic. In India, we are facing a lot of issues, sir, while dispensing medicines, especially. In the medical store, it happens. If rights are given to me, I can share one slide also, sir.
Please, sir, you can share, sir. You have all the right now, sir.
Just a minute. I would like to share one slide, sir,
Please,
and I
sir.
would like to show you one thing. Just a minute.
Is there a scribbled prescription written in Arabic?
Because prescription handling usually 1 lakh per day per annum, sir, is there due to prescription error. And in India, we are having similar brand names with similar pronunciation, as well as look alike drugs are also there. So that is making a basic issues while dispensing the medicine. So this is the one which I would like to highlight, sir. Just a minute. I'll show you in PowerPoint presentation. Yeah.
Yes,
So this is the one, Medzol. See, now it is Medzol. It consists of itraconazole, that is antifungal. Medzol is available as metronidazole also, and also as pantoprazole, and also as omeprazole, and also as albendazole. So this is the pronunciation where Medzol is pronounced as Medzol itself, and we are having different content in it. So here the prescription error chances are very, very high, sir.
Absolutely. What a confusion.
Yeah.
So a lot of confusion is there in this case.
Nehal, sir, we
That's
should have
why-
a presentation on this topic.
Yeah, that's why I believe the generic name has to be in bigger fonts than the trade name, because the trade name in bigger fonts than the actual chemical name or the generic name. So these are some of the things that the industry has to make some changes, but long way to go. Some of the organization like IPC or Health Ministry has to introduce those regulations. Yeah, very good example, Dr. Shah.
And we are having one basic issue also, sir. We are not having uniform system of prescription. Some are computerized prescriptions, some doctor used to write by handwritten. So handwritten prescription errors are very, very high at our end, because they are having the OPD of 150 or 200 patients in a day, and they do not have much time to write the prescription. As physicians, they do not spare much time to write the prescription. And if you can see the errors, some prescriptions are not readable. See, this is the one which is called as bad prescription.
Yeah, this one is much clearer. I can read it. I have seen prescriptions, I believe, couple of prescriptions we put in the LinkedIn, one from Manoj and one from me, my family member's prescription. We put it out there. I couldn't figure that out at all.
So there are chances of prescription errors because of these factors. See this one more I would like to show you.
Yeah.
This is one.
Appears to be a Vasotec, 20 milligram, number 30. It could be read as Zantac.
Yeah, that is how it can be read as Mantine also, which is cephalosporin. And actually it was prescribed as angiotensin converting enzyme inhibitors, antihypertensive.
Right.
Which was Valsartan 20 milligram.
Yeah, Enalapril.
So
I could read this actually. It's not that bad.
What we are not having uniform system of prescription. That is the problem we are facing.
Yeah. It's unfortunate.
But right now, in some of the bigger hospitals, they've started this e-prescription system, which is completely automated and online. So it's mostly, a computerized system. So there is no use of any handwriting there. In some of the hospitals.
And that is required now.
That is needed, sir. Yes, sir.
Yeah, that is needed.
Yeah, it has got to be mandatory.
Yeah. I'll go to that slides and I'll give you the rights.
In fact, in our hospital, last week when I went to work, I work only part-time now. I've kind of retired. That's why I'm able to spend some time in this venture.
And as you correctly mentioned, review of prescription. Very few medical store used to follow that review of prescription. Very, very less.
Yeah, because there is no pharmacist in the drugstore.
Yeah, there are pharmacists.
Candidates.
But
the certificate is hanging, nobody there. So
yeah, yes,
all those
you are very correct. So that is the basic issue we are facing.
Yeah. Any questions from the students, Manoj, by any chance?
Yes, sir. I have two questions, with me. One is from Adarsh. He says, what is the main mechanism to limit mistakes in clinical prescription auditing?
Main mechanism
to limit mistakes in clinical prescription auditing. How can we prevent, how can we, automate probably clinical prescription auditing? I don't know. Is it
automation, right? Automation. When the prescription comes to me in the hospital, when I process it, the system itself has software that can check for drug interaction, dosing, patient's allergy. It kind of check and does the job for the most part of the bullet points we discussed.
Yeah.
Then we make a professional judgment. I believe automation meaning the system that you use has to be a computer with all these drug interaction check, dose check, patient's allergy check. Everything has to be done. So that provides the AI, the artificial intelligence put in the computer. That will probably be one of the systems that we can have. Of course, India has knowledge and ability and advancement in computer systems, creating software. They're very good at it. In fact, America, Microsoft, and Google and all these places, Indians are the one who is doing the important function there. So why can't India do it there itself? So that system has to come up by implementing a proper computerized systems where most of the things are checked and help the pharmacist. Then you make the clinical judgment to call the doctor and make sure the prescription is dispensed appropriately, because patient is important. Yeah. Patients are simply dying. I got a case to tell you in my family. If I get a chance, we will talk about it. I think I'm taking too much time.
That's fine, sir. So, another question could be, a sub question could be, what is the way we can reduce errors in clinical prescription auditing? How can we reduce errors or in clinical prescription auditing?
Yeah. I have made one of the slides tells you the bullet points, right? Those are the primary salient points. You got to make a slide or something, a little bit of notes, cheat sheet notes, and then check those boxes whether we have checked all those criteria prior to dispensing a prescription. We have discussed that in detail in the particular slide. I think that's what the question is.
Yeah, looks like. Or if others, are you on Zoom? If you want to unmute and ask Dr. J directly, that is also fine. We'll give you the unmuting right. And there is another question from Divya, sir. She says, quite informative session. Thank you. Any suggestion to remain up to date with latest clinical guidelines? Where should a beginner get this information?
Did she mention uptodate.com?
She wants to know what are the sites from where we can get this latest clinical.
Oh, I see. What's the name of the student?
Divya.
Divya. Hello, Divya. Appreciate the question. It's a good question. if I can share the screen and show the website that I'm using. Is that okay, Manoj?
Yeah, please do
If
that,
I
sir.
mess it up, help me out here. I'm going
Not
to
a
share the
problem.
screen now, right?
Yeah, sure, sure.
Please share the screen.
And others will take you the question, take your question in a moment. Let sir finish of this.
Okay.
We can see the Zoom screen and up to
Can you
date.
see the up-to-date?
Yeah, up to date. Yeah.
Okay. This is one of the website, the uptodate.com. This is the one that I use 90% of the time. This is the one that the doctors use it too for diagnosing the disease, for looking at to find out what kind of diagnostic procedures they have to do. It's a site that gives information both for the doctors and the pharmacist. For example, I was talking about Bactrim DS for the hospital patients. When I go and type in Bactrim DS, here comes in at the bottom, dosing adult. I click on that. And then if you look at the left-hand side, you can also see dosing adult, dosing renal impairment, and also dosing patients with hepatic impairment. So this patient has, that hospital patient we discussed about, the creatinine clearance was about 45, 50 ml. When I go down to see the dosing adult, underneath, if I scroll up, at the very bottom, you will see urinary tract infection.
Yeah.
When I click on that, you get the urinary tract infection, cystitis, acute, uncomplicated infection. If you see here, oral, 1 double strength tablet twice daily, treat female for 3 days. And for male, it's for 7 days because of the anatomy. It takes few more doses. For ladies, it's only for 3 days. This is where I got the information. This is where, this is what you should make a reference when you're speaking to the doctor. According to the update.com, for uncomplicated urinary tract infection, 1 double strength of Bactrim DS twice daily for 3 days is recommended. Doctor, would you like to consider that? It's not only inexpensive, it doesn't have the side effect that we talked about on the Cipro, tendinitis, QT prolongation, and C. diff in the stomach and all that. She's an old lady, so we got to treat her gently. I'm just saying that. I'm not going to say to the doctor. I'm just talking to you. That's how I locate the information. And of course, for the renal impairment, I want to make sure this dose is appropriate for this lady because her renal clearance is compromised. When I go in here and click on the renal impairment, here comes the creatinine clearance. See here, creatinine clearance, greater than 30 ml, no dosage adjustment is necessary. So that's a full dose, 1 tablet twice a day for 3 days. If the creatinine clearance is between 15 to 30, then reduce dose to 50% of the usual dose. That means we can give 1 tablet once a day for 3 days. 1 tablet every 24 hours or 3 times per week. These are the recommendations under renal impairment. That's how I get the information. This website is a combination of drug information from Lexicom, put in uptodate.com, both together embedded. So uptodate.com is a great, great website. That's what most doctors use here, and I also use that. So it's kind of, they charge you some money. I think it's being introduced slowly into Middle East and India. You would have come across that. If the university can purchase that, we can train the students on this website.
Perfect, sir. Thank you. So there are some other options also for looking for such information. One is, of course, PubMed, where we get all the clinical data.
Right.
We have Micromedics, where, most of the universities have subscribed to. We have Lexicom, and we have, in India, we have SIMS, IDR, and in other countries we have MIMS. They're all drug directories where we get a lot of information. And companies like SIMS, they have also, created softwares that help clinicians and pharmacists prescribe properly and do a proper auditing of the prescriptions by getting to know the side effects, the drug interactions, and all of that. So many hospitals, here in Bangalore, such as Manipal and Fortis, they're using such softwares. And when I was part of SIMS, we had closely interacted with them for setting up that. So there are, right now there are a lot of tools. I know a couple of pediatricians. They don't write, prescriptions by hand. They use softwares to create printed prescriptions.
Excellent.
And this becomes a repository for them, for further references as well. And for the patient, it becomes much more easier. We are also working with a couple of doctors wherein we are trying to set up a system wherein all this prescription can be shared between the doctors and the patients just with a single login with the OTP. So that is also in progress, and a lot of things are happening in, of course, in India, we are doing a lot of work with respect to prescriptions and patient-centric approaches. A lot of things are happening. So thank you, Jay sir, for that note, and thank you, Nehal sir, for your support here. Adarsh, if you want, you can unmute and ask the question. That will be much easier. Adarsh, you can unmute. Others, if you can hear me, please unmute and ask.
Others, right has been given to you. You can unmute and ask the question.
Yeah, that's what
I think. Others, can you hear us? Yeah.
Yes. Perfect. Go on, please.
Hello. So first of all, good morning to one and all present here.
Good morning, Adarsh.
To Jay Pillai sir, Manoj Kumari sir, and Nehal Shah sir, and thanks to Ambika sir for giving us this opportunity for being in this Zoom platform. I'm Adarsh from Tirthankar Mahavir College of Pharmacy.
Perfect.
I'm pursuing Doctor of Pharmacy and I'm in 4th year. So just I want to ask, can this be the topic, whatever the topic was of this Zoom meeting, can this be the topic for the work in 5th year research work, or as in for the article publishing or somewhat? And this was my first question. And my second question was where to get recent updates and clinical information regarding the same.
Okay. Thank you, Adarsh, for that question. Jay sir, would you like to answer that?
Could you repeat the question for me, Manoj? Apologize for that. I think gentleman is asking about clinical information, where to collect it.
Yeah, so 2 questions he asked. First question is, could he take your slides topic as a topic for his research in 5th year? That was the first question. And the second question was where to find the clinical information, latest clinical information. So I think second question we already answered. Up to date, PubMed and all these resources, Lexicom. If you go to my LinkedIn, profile, I have also posted, long back a host of resources. So that was the answer to that. And regarding the use of this topic for your research, I think Jay sir is the best to answer. Jay sir.
Oh, you want to use the topic that I presented for your clinical project, something like that. It's up to you guys. I have no problem because we have presented this through one time through you and this time through the college. If there is any kind of issue with that, I don't know. From my side, probably it's okay to get some information from this and do your own project, not completely duplicating it. Absolutely. And presenting it. That would be my suggestion.
Yeah, so, thank you, Jay sir, for that, generous support. And to others, my suggestion would be take one element from this and expand that. Say, for example, you want to take one of these drugs, like, for example, Bactrim you want to take, or you want to take any diabetic drug. Just take one drug and study that thoroughly and, give a proper auditing, to analyze various prescription related to that, analyze the response to the patients, do a proper research around one drug. So it will be a good research, and also it will be helpful for the community, because at the end of the day, whatever we are doing as a pharmacy professionals, it has to be helpful to the community at large. It is not about just doing the research and publishing somewhere, but it is about creating some impact in the society. So we are there to support you. In case you need any support from us, do reach out to us, and we'll be more than happy to help you out in that. Okay. And some of the research that is happening right now in Bangalore with respect to similar topics, like they are working on patient adherence with diabetes medicines, hypertension medicines, cancer medicines. They're mostly working on adherence part, because that is something which is lacking right now, and there is no support which is given from neither the doctors nor the patients. And you can also work on some patient counseling elements, which is right now not so advanced in India. Effect on various organs, side effects, all of that parameters you can study for one drug. Take any one drug, don't make a khichdi out of it. Don't make so many classes of drugs. That would be my suggestion. I've been working with a couple of Pharm Ds here, and also doctors. So take any one drug, and one therapy area basically, and work on it, and spend good quality time, because it is not just publishing something. It is all about what knowledge you gain, because at the end of the day, we are talking about pharmacovigilance, medical writing, and all these aspects so well in India. And if we don't do the groundwork like you guys are doing at the basic research, all of that we talk will be just like a talk, right? It will not be into action. So do that. And then, yes, Jay sir is there. He has already given the email ID. My email IDs are there with you. Ambika is there. Nehal sir is there. We are there to support you guys. So thank you, for that. And Nehal sir and Ambika, if you're there, stages for you to open up, and then we'll continue. I think we have received the quizzes also.
Yes, sir. Yes.
Thank you.
Nahid.
Thank you, sir. Welcome you all in the second section of the Pharma Philia 2022. Now I would like to invite Dr. Akshay sir for introducing the today's eminent speaker, Manoj Kumar sir.
Dr. Akshay sir has joined.
Yes.
I think yes.
Good morning, everyone. Am I audible?
Yeah. Yes, sir.
Thank you. Thank you. Today, I am going to introduce our second speaker for this webinar, Dr. Manoj Kumari Yadav, sir. Currently, he is working as Cluster Head, Medical Communications and Digital Solutions, Pharma Pulse. It's my privilege and honor to welcome Dr. Manoj Yadav, sir, and presenting a brief biodata of him. Dr. Manoj Kumar Yadav, sir, has done his bachelor's and master's degree in pharmacy from Government College of Pharmacy, Bengaluru. He is a GATE qualified pharmacy professional and a certified digital marketeer. Manoj sir is currently pursuing his MBA and PhD and is an author of upcoming book on pharmacovigilance for pharmacy students. During his 14+ years of association with corporate pharmaceutical, Manoj sir has helped pharmaceutical organizations set up their digital and automation strategy from the scratch. He has helped many companies and organizations to utilize the power of online with conventional offline strategies in their existing organizational setup. He has been instrumental in setting up online CRM platforms and online repositories for several leading pharmaceutical companies, institutions, and hospitals in India and abroad. His key areas of interest include online automation, medical and pharmaceutical communications, transforming conventional communications to digital, creation of online repositories, mobile apps, data analytics, and many more. Manoj sir is also associated with several doctors and healthcare providers and has been instrumental in implementing digitalization in many state pharmacy councils. He has played a key role in digitalization of some of the pharmacy council in India, including Karnataka State Pharmacy Council and Himachal Pradesh State Pharmacy Council. It is appreciable. He loves to teach the basics of digitalization and software utilization to pharmacy professionals for better adoption of technologies via his digital literacy program. To aware the students and to disseminate the knowledge, he conducts weekly webinars every Saturday at 2 p.m. via Zoom for pharmacy professionals. So this is a brief data regarding Dr. Manoj Kumar sir. I heartily welcome Dr. Manoj Kumar sir to give his speech and create awareness. Thank you, sir. Welcome, sir.
Thank you so much, sir. Thank you so much for that introduction. It was wonderful. Thank you again. And two corrections there. I'm still working on my PhD. It's not done yet. And the second is my upcoming book is still already printed. I just got the copy of it 2 days back. Here it is. Yeah, here it is. I got that copy just day before yesterday. It's a wonderful book. Yeah.
Congratulations, sir.
Thank you so much, sir. So thank you so much, Nehal sir, Ambika, and Akshay sir for introducing me and inviting me to share my, whatever little knowledge I have with respect to this topic. Let's see if, we can get into this and then learn something. Okay. So all these, presentation slides is based on what I experienced during my 15 years of experience, corporate life. And I've seen students, struggling when they come out of the college. So the objective of this presentation to give some thoughts to them when they're still in the college and see what they can do to take some action and, become a better version of themselves. So I started this webinars, I do this every Saturday at 2 p.m. and create awareness about career objectives. We have done on 20 plus topics, already, and all the speakers who come for these webinars, they are 10 plus years experienced in the domain of pharmacy and different subjects and topics. So some of you, if who are interested in exploring what are the various career options, you could just go to the YouTube and search for medical writing, pharmacovigilance, and other subjects and topics. And I'm sure you'll get a glimpse of what happens in the industry and what the industry is expecting from pharmacy professionals. So before I begin, using the chat box, guys, if you're watching it from YouTube, just give me a thumbs up. If you're on Zoom, just give me a thumbs up and confirm me if you can see me, hear me clearly, and tell me how's the Josh. How's the Josh? It's 11:40 now. How's the Josh? How was the first session? How's the Josh now? Hi, Rohit. Thank you. Perfect. Go on. Amulya, Rajendra, Shurya Prakash. Hi. Great. Josh should always be high. Okay, because unless the Josh is high and we are not active, we are not there, right? So just be on the high Josh with high energy. Whatever we do, we have to be excited for doing whatever we are doing, right? So, with that, let's begin our presentation and let's see what is in there for us, all of us today. And at any point of time, if you want to ask any questions, I've already shared the link, for you to ask the questions. Do that, and then I'll be more than happy to answer you during the Q&A session. And the questions you can ask me can be related to career, can be related to digital, can be related to social media, can be related to websites, softwares, whatever you want. Don't ask me subject related questions because you have all the lecturers and professors who are there to guide you with respect to subject. I'm not the right person to help you for your subjects. But yes, for all these other skills, digital skills specifically, if you have any questions, I'll be more than happy to go on. So are we clear? Just type CLR if you're clear, and then I'll start. Perfect. Thank you. Thank you. So this is my first slide. What are the skills that we can learn during the college for a successful career? The first skill, of course, is to study whatever you are studying. Whatever domain you are, if you are a D Pharm, please study all the subjects properly and have a thorough knowledge. There is no shortcut to knowledge. There is no shortcut to all these shortcut books that are getting printed subject wise as per the PCI syllabus. They are helpful, of course, to get you good marks. But as far as the knowledge is concerned, you got to get dive deeper into the subjects. So study well whatever you are studying. If you are a D Pharm, please study all the subjects that are prescribed in the D Pharm subject. Apart from that, you have to have all these skills that we are talking about now. There are so many other skills which I might have missed out, but then they will come eventually to you. But these, I feel, are the basic skills which each one of us, when we plan to come out of the college, the moment we come out of the college, we should have all these skills. So if you are, understanding what I'm saying, it's perfectly fine. If you are feeling that I'm too fast, just let me know, stop me, and then, we'll continue. Okay. So I don't want to be too fast or too slow, but I want you to understand everything that we are talking about. So what are we going to, understand in this, slides? So there are a few things that we'll be understanding. Of course, there is a content that I have planned for this. I'll be, giving a stepwise number of skills that we have to learn during the college. Then I'll also tell you how these skills would help you. Okay. And then we'll try to recap. So here is the important point. So you have to make notes. And when I'm asking during the recap, you have to keep on answering. Okay. So please make notes from here on about the skills. Then we'll have a Q&A where you can ask me some questions related to digital, related to career, related to higher studies, work in foreign countries, all of that we'll discuss. Perfect. So let's see. So what are the top skills? The first skill is assertiveness. Okay. This is a very, very important skill. And today, sadly, most of us are losing that. So what is assertiveness? Okay. It is the quality of being self-assured and confident without being aggressive. So you're self-assured and confident, but not aggressive, right? So you're in between, right? You have to be very, very confident and be self-assured. You then become an assertive person, right? So this is how it looks. You have an aggressive person, you have a passive person who just is a looker, okay? And you have an assertive person who is in between. So you have to be in between. You have to be balanced person. You have to be logical person, right? So how it helps, okay? It helps by helping you to express your opinion and speaking directly, okay? It helps you to take your opinion and follow your own, take accountability for your own mistakes, okay? Then it also makes your, you have to have your eye contact when you're speaking with others, right? And then you have to make sure, when you are creating a voice for your decision, when some decision is being made, you have to voice up, right? Then you have to ensure that everyone who's in that meeting listens to you, and then you have a common voice coming out of that meeting. And then most importantly, it helps you to take pride in yourself and your team. So you become more responsible and more thoughtful, right? Now let's see what are the different benefits of being assertiveness. So number one is you earn people's respect, right? So I'll give you an example of being assertiveness. One of the examples that I could recollect right now is Ambika, right? He has been following up He has been leading this entire, Pharma Philia session, right? And he has earned that, all of our respect, because he has been pivotal in arranging this entire session, right? By being assertiveness, you also increase your self-esteem, self-confidence, right? You reduce the anxiety and stress because you are connected to people, you're confident, you'll no longer be in stress, right? You can be a better manager, right? By doing this. And finally, you can find a win-win solution for everyone, right? Basically, you become a solution finder. So this is all about assertiveness, and let's understand about teamwork. So teamwork is again a very, very essential capacity, or quality that every industry today is looking for. So if you are looking for a job in pharmaceutical industry or any company, being a team worker is one of the most important quality, right? So let's try to understand, if you are collaborating in a team or if you are independently working, so which one do you think, gives you a better output? So if you feel that teamwork can give you a better output, type T in the chat box. Or if you think that, being independent gives better output, then just type I. What do you think? Let's try to understand. What do you think? Yeah. So Divya says T, so it is teamwork. Rajendra says yes, T. Jaya says T. So yeah, majority of you, right? So majority of you always feel that being in a team can give a better output, right? And also it helps us to understand and learn better, right? So this is what happens. It also helps you to be more responsible, because when you are in a team, rather than giving your work to somebody else, you become responsible in taking your part of the work, right? So you show your responsibility. And most importantly, when you are working in a team, जब आप किसी के साथ टीम में काम करते हो, तो आप ज़्यादा सीखते हो. You learn more, right? आप ज़्यादा सीख सकते हो when you are in a team, right? So next, the companies that are looking for is creative and problem solving. Whatever you are doing in your life, you are in the college right now, you are a student, you have to be creative. You have to be a problem solver, not a problem creator. Most of us, when we are in the college life, we don't want to take any responsibilities. We just want to throw that to somebody else, right? Because if there is a problem, we'll be caught, right? We don't want to take that tension and headache. So we should not be like that. When you are in the college, you have to be creative, learn the problem solving skills. Whenever you find a problem, try to solve it in your own way. And you never know that can be the best way and the most unique way to solve that problem, right? So think about it. And the final one is communication. When it comes to the top skills, communication skill is one of the most important skill when you are coming out of the college. Not just out of the college, everywhere for the rest of your life. Communication is one of the most important skill. So let's see, communication can be oral, or verbal. When we are talking to somebody, two people talking to each other orally, right? So that is one type of communication. And please don't misunderstand me. Communication is not talking in English, okay? It can be also talking in your own language. So communication, good communicator does not mean that that person is a good speaker in English. No, please, it's a wrong statement. Good communicator can be anyone who can communicate whatever he wants to say in his or her own language to the persons opposite to him or her, right? So English is just a medium of communication, right? You can also talk in Gujarati or Hindi or Marathi or whatever language. All we need is to communicate effectively to the opposite person. As long as we are able to communicate, that is perfectly fine. But English being the medium of instruction and an official language for most of the places, we have to learn English as a medium of communication, right? So written, this is again, most of our pharmacy professionals are not so well, on this part. Writing, providing a written communication is very, very important. And this will happen only if you are a good reader. I feel personally, because I have been a medical writer as well. And I personally feel that unless we read more, we can't write well and write more, right? This is my personal understanding, but then some of you may not agree with me on this, but writing is very, very important. So Your written communication plays a good role, whether you are a blogger, you write, on LinkedIn, or you write on Facebook or Instagram, whatever, wherever you are, whatever medium you are choosing, please understand that writing in a good way is very, very important. Communicating in a very good way is very, very important. And writing, again, is not just the text. It can be graphics, it can be some creatives, it can be some design. Okay, so all of that can be combined and you will have a good written communication. Then online, this is again, all of us are online right now. This conversation is happening online. So how we communicate online with the help of chats, okay, with the help of some text, with the help of some WhatsApp chat or Telegram chat or whatever, is very, very important. What language we use, whether we are using a shortcut language, the opposite person is understanding or not, it is very important. So whatever communication you are using on online tools, please understand that the opposite person may not understand the language, the short forms that you are using. You are youngsters, you might, as in the college level, you might be using some shortcuts for interaction, but the same language you should not use when you're interacting with somebody outside your world, online. You have to use the full forms always, communicate effectively, and always convey whatever you want to convey. I get a lot of messages on LinkedIn. I have not known that person forever, and suddenly I get a message saying that, sir, please help me to get a job. Now, since I don't know that person, how do you think I'll be able to help that person, right? This happens with all of us in real life. So you go to you are walking on the road and you suddenly meet some unknown person. Do you think, and that person asks for a help, how many of you would agree and want to help that person? That person is not known to you, and suddenly he says, okay, hey Baswaraj, or hey Masira, or hey Vidhi, please help me. You guys will help him or not? Type yes if you will help him, or type no if you won't in the chat box. Waiting for it. If you are there. Okay, Adarsh says yes. Mashra says no. Yeah. Yes, no, yes, no. So again, it's a divided opinion. So supposing that I'm walking the road and I see a person who has met with an accident and he's seeking for help, most likely I'll help him. But if a unknown person walks in and just says, okay, just help me with whatever, and then probably I'll not help him, because this is what we are taught. This is what we learn, right? Don't help strangers. So you can't help just walk into somebody and ask for a help, right? So it's on the online world also, it's the same rule. If you are seeking for help from somebody, please introduce yourself to that person. Ask what it is that you are asking for help, right? If you're looking for a job, first tell him who are you, from where you are, what you have done, and why you are looking for that job in that particular domain, right? So that person knows something about you, some basic introduction. Without introducing, probably will not want to help, right? So this is the second one. And when you're chatting with the person, please be specific to the point. Don't, on LinkedIn, don't connect to somebody and say just good morning. That means nothing to that person. That person might open that chat in the night sometime, and then just by saying good morning, he will not understand anything, right? So just give the full information there. And then when the person reads whatever time he is comfortable with, then he knows the entire scenario, what you are wanting to connect with, right? So next is the email. This is again a very, very important tool for all of us. And we must be able to write well emails, right? Good emails. So there is a video on YouTube. If you're watching on YouTube, I had posted long back. It's called Netiquettes. The title of the video is Netiquettes. I've given a list of the specific things that you have to watch out when you're writing an email. So just watch that. And then blog. So if you want to communicate effectively, whatever your ideas are, whatever your thoughts are to the world, you can start blogging. So there are a lot of free tools available for blogging. The LinkedIn is a great tool. Again, we have so many 700 million plus people on LinkedIn, professional people on LinkedIn. So if you want to talk something about some topic, LinkedIn is a great platform. Use that and start communicating whatever you want to communicate. Videos. Nowadays, a lot of people have started doing videos, shooting video using just the camera and shoot whatever you want to say. But then here also communication plays a very, very important role. So you have to have 3 important points when you are trying to shoot a video and tell the person whatever you want to say, right? First thing is, what is this video all about? And everyone, when they want to attend a session or watch a video, they want to know what is in it for me. What will happen if I watch this video? What is it that I'll be getting after watching this video? So if you are able to clarify that point, and also at the end of the video, you should be able to tell him or her that how you are going to help that person. So 3 main important elements to a video, and you are there online, right? So just let me know if this is clear. You understood the concept of communication on online via chat, emails, blog, and videos. Type yes if it is, type Y if it is clear, and no, you can just ask me if you want to anything, right, on this. So thank you, Rajendra, Chinju, thank you so much. And yes, thank you. So this was all about online, and online is, very, very important, and we cannot ignore the importance of online. Whatever we are doing right now is also a mode of communication online, and all of us are connected from so different places, right? And we are trying to learn something. So that was another point. And the next point is self-management. Self-management, professionalism is both are same, right? So how you manage yourself, how you dress, how you speak to your coworkers and clients, your friends, your classmates, your teachers, your faculty members, how you present yourself in the personal interaction, all of that matters a lot, right? So this helps, people to understand who you are as a person and how you can help them, right? In self-management, again, this is very, very, very important, and most of our pharmacy professionals are failing because of these missing points. So first thing is, we don't have any personal goals. So we are doing B Pharm, D Pharm, M Pharm, Pharm D, or PhD. We don't know where we want to go, right? So just imagine you have to come to Bangalore or any other place, and you want to use Google Maps. The first thing it will ask you to put the destination, right? The destination setting is very, very important. So similarly, when you are in B Pharm or M Pharm, you should be clear you want to go for a higher study or you want to go in for a job. If you want to go in for a higher study, you have to be again clear what type of field, which college, which country, whatever, right? If you are going for a job, you have to be clear what type of job, which type of domain, which place, which state, which city, which type of company. Is it a biotechnology company? Is it a manufacturing company? Is it a sales company? What kind of company, right? So these are all personal goal. Your personal goal or Mr. Rajendra's personal goal will be different than my personal goal. Ambika's personal goal will be different from Basuraj's personal goal. Rishikesh's personal goal will be different from Adarsh's personal goal, right? So all for our personal goals will be different. Though we are in the same domain, we are working on the same, we have to be clear on what we want to do. So Adarsh, what was it that was confusing in the blog? Could you ask me? I'll just unmute you. Adarsh, if you can hear me. What was confusing? Please. You can unmute and ask me.
Actually, sir, the blog part was unable to understand. I was unable to understand.
Okay, fine. Got it. I understood. So what is a blog? Do you know what is a blog? Adarsh, do you know what is a blog? Okay, Adarsh knows what is a blog. So blog is a way of communicating through online medium, right? It's a website. Like website can be a blog. Facebook can be a blog. One of the ways can be communicating, right? So you have to choose your topic. You have to write the content, and it has to be consistent. Like for example, if you go to my LinkedIn, I write mostly about career, about pharmacy, about clinical practice, and all of that, about software utilization and all of that. So we have to be clear on what we want to communicate first, and it should not be a boring blog. It has to be an interesting blog. So how do you make it interesting? You can make it interesting by using videos, by using images, and all of that, right? The title has to be clear, the topic has to be clear, the content has to be clear, and the medium can be different. It can be either English or your own language, no problem, right? So was that okay for you? Was I able to explain that? Type yes if it is, or still?
Yes, sir, I was.
Perfect.
Yes,
Okay. So
Thank you,
you
sir.
can connect with me later on if you want to, and then we can discuss more about how do you do blogging. Okay. So personal goals. I was talking about personal goal. It is very, very important, and we have to set our personal goal where we want to go. So if I'm in B Pharm, I have to set where I want to do M Pharm. If I don't want to do M Pharm, then which company I want to work. So my studies will, vary if I want to go into formulation. My study will vary if I want to go into production, right? So everything depends on the goal, the end goal, right? Then study skills. When you are in B Pharm or M Pharm or PhD, whatever you are doing, your study skills are important. So apart from the prescribed syllabus, you have to also study other books, other topics. You have to be aware of what is happening in the world, right? So today, if I have to give you some example or analogy, just consider 2.5 years, last 2.5 years, what has happened in digital era, in digitalization, with respect to digitalization in India, not just in India, but globally. Just in 2.5 years, we could achieve more than 10 years of development, which was squeezed to 2.5 years, right? This is not just in India, every single domain, every place it has happened. So vaccine, we would have otherwise taken about 10 years, 15 years to get the vaccines into the market, but we could get it in just 1.5 years, right? So much of data we accumulated and generated and analyzed and published, we got it because of the machine learning and artificial intelligence, right? And we as pharmacy professionals, whether we are a student or professionals, we have to be aware of what is happening in the domain if you want to be in the domain. If you don't want to be in the domain, then you have to know about other domains as well. So apart from your study skills, your subject knowledge, your regular subjects, you have to know everything, at least related to your personal interest. So first you have to set your personal goal. Once that is set, based on that, you have to modify your study and also your other learnings, which is very, very important. Next, time management. All of us have the same time. Nehal sir has the same time. I have the same time. Dr. J has same time, 24 hours. How we utilize that time is important, and it is all dependent on us. So we have to create a calendar properly and then start utilizing the 24 hours time so that apart from our personal goal setting, study skills, and overall growth, we are also able to help our health, because in the way of managing time, we most of the time are not focused on maintaining our good health, right? We lose health at some point of time. So we have to be focused and manage the time very, very effectively, because all of us have the same amount of time. Work ethics. This is again a very, very important objective or tool which can help you to progress faster in the pharmaceutical domain or any other domain. You have to be very, very sincere. You have to be very, very nice. You have to be very, very good, organized, and ethical person, right? You should not do cheating and all of that. And ultimately, to achieve all of that, you have to be active, healthy, fit, and fine, right? So this is all about self-management, and you can add so many things here. In personal goals, you can talk about SWOT analysis and personal SWOT analysis and all of that, right? So next comes to the leadership. So how you leadership is again very, very important. Like, for example, again, if I have to give the example of Ambika, he has been a great leader, good leader, right? He has been connecting with so many people. He has sent you personal invitation. He has been connecting the community, the pharmacy community, and all of us together, right? So he has been a leader. He has been patient. You have to be patient. You have to be very, very patient. You cannot be aggressive. You cannot lose control, right? So that is one of the quality of being a patient. Then you have to be self-motivated. You need not necessarily be always motivated by seeing videos or watching videos on YouTube. How many of us get motivated by seeing the videos, and after 5 or 10 minutes we just come to our normal position, right? So if you're a self-motivated person, that will not happen. You will be always self-motivated to do something good, right? So we got to be self-motivated. We have to be decisiveness. We have to have a decision capacity. We should be able to decide something with our life, right? Or whatever we want to achieve. Then we should be able to build a team. So these are the 4 important characteristics or features of being a good leader, right? So you have to decide whether you are a good leader or a bad leader. So if you're a bad leader, you have to improve on these things, right? Next, networking. This is most important today. whether you want to do a business, whether you want to study, whether you want to apply for a job, whether you want to connect with people, networking is very, very important. Right now we are connected. We got connected via LinkedIn. I got connected to Dr. J via LinkedIn. Ambika got connected to me via LinkedIn. So all three of us got finally connected via Zoom or WhatsApp or so many other medium, right? So networking is very, very important. Today, one single sentence to define networking is your network is your net worth, right? So what kind of network you have defines what kind of net worth you have, right? So again, networking can be personal, your family members, friends, and all of that, and it can be professional. So when it comes to professional, you have so many other tools, but one of the best tools is LinkedIn. So utilize that, and then you can be wonderful. And when you are in the college life, you have to be connected with your alumni network, because you should know where they are and what they are doing, right? There will be so many alumni members who will be doing wonders in the field. And imagine if you are connected to one of them, you can be professionally, very, very informed about what you want to do next, right? And online tools make it very, very easy for us to do it. Research skills. This is very important. So whether, if you're a Pharm D, you might be doing your research in 5th year or during your internship, not just for your project, but, you should have a research skill for everything that you want to do. Like, for example, you want to connect to a right person, you should be able to research about that person, know about that person, and then connect to him. Project, yes, you should be able to do research, what is happening in that domain, who's doing what, which other countries are doing good, in which other states in India are doing good. I gave the example of, diabetes medicine and how this adherence can play an important role, right? So if you know that what is happening in other places, you can tweak that, modify that to meet the requirement of your place, right? In your locality, in your area. Remember, we don't have to change the whole world. If we are able to change a little bit in our own, domain, in our own community, that is great enough. And that is what I personally feel. And that is what I have been doing. Okay. Internships. If you have a good research skill, you can find out internships faster. You know which internships are available, which countries, which states, which, domains they are available, and how to apply for them. You can get job faster if you have the research skill, right? So you can also get to know about higher study options in other countries if you have good research skill. You should not depend on anybody else for all of this. You have to do your own research, right? There are hundreds of tools available online, and I have been also telling about many of these tools during our webinars. So watch out for those webinars, and if you have to make notes, please make notes, prepare well, and then do your project well. Go for an internship, apply for a job, or go for higher studies. And don't just settle down for higher studies in India alone. Explore the world. There are thousands of universities across the globe, and many of the universities are, giving stipends and scholarships. So apply for them. Do your research first, and then go for it. Digital literacy, very, very important. You should have the computer skills. You should know how to use the computers, what kind of software goes into the computer, what software is available for you and good for you. There are, thousands and lakhs of softwares, right? But we don't want to use all the softwares. We should be able to use at least 5-10 softwares in our day-to-day life. So computer skills are very, very important. You should know what configuration of computer works for you, what kind of software goes into that computer, and what kind of software is useful for what kind of work. All of that is very, very important, right? Online skills, yes, very, very important. So I talked about the communication, that is one of the skills for online, but then in online also, what kind of domain you are going for, that is very, very important, right? So let's recap. So what are the main skills that you have to study in or know in your college life? You can use the chat box, and let's try to understand. What kind of skills? So are you with me? No. Okay. So it's very, very important to have these skills in your day-to-day life when you are in the college. First is, of course, being assertive. right? Next is teamwork, creative and problem solving. You have to solve the problems. You have to be a good communicator. You have to have the self-management and professionalism skills. You have to have a leadership skills. You have to have a networking skills, research skills, digital literacy. And all this will come if you have a good digital literacy and connected to people across the globe, right? So now how do you use these skills? Once you have these skills, how do you want to use them? That is again an important part, right? So we should be able to learn the skills only if they are useful. Most of us don't want to learn anything, if we don't find them useful, right? So once you have the skills, you can showcase these skills during your college life. So you can be, part of an organizing team, right? So like, for example, Ambika has organized this. So he has a team. There are people who are supporting him as a team, right? So he has a boss, Dr. Nehal, and he has a faculty members. Then he has a team members who are helping him to organize this. So there is a leadership skill which is coming into picture. He is communicating with people, across for this particular session. He spoke to me, he spoke to Dr. J. So there is a communication skill. He wrote emails. Then there is again your communication skill. He communicated through the WhatsApp and other platform. That's online, skill. That is digital skill. So you can utilize this skill wherever you are right now, in the college, in your daily life, okay, in your personal life, in your professional life. Everywhere these skills are useful today. So we have to have these skills, okay? Now, this is again a very important thing that I want to talk to you about, the online presence. All of us are using Facebook, Instagram, Twitter, right? Which one of the platforms you are most active on? So type which platform do you use most often? Most often. Which platform do you use more often? Every single day, which platform do you use? You can use the chat box so that you understand which platform do you use. Instagram, WhatsApp, Facebook, LinkedIn, but not every day, okay? Okay. LinkedIn, Facebook, Instagram, Facebook and Instagram, okay? So see, all of you are using this platform, but how you are using is again important. Are you using for a time pass or are you using for gaining knowledge? Is very, very important. Are you using it for building your reputation or creating your own brand? Is again very, very important. So many people, so many recruiters are checking this platform for hiring the candidates, right? So whatever you do online today is monitored, okay? Number one point. Number 2 point, whatever you send online or do online stays online forever, right? You might have posted something on Facebook and deleted, but imagine that goes into the database of Facebook and is never ever deleted. It is shown deleted only for you, but remains in the database, right? So whatever happens online remains online forever. So you have to be very, very careful as to what kind of content you are posting, what kind of information you are sharing. I know many people, many students who posted religious or political things in their Facebook and Instagram, and they were not given a job. Okay. So this is very, very important. Recruiters today are hunting for right candidate, and they want to ensure that whatever candidates they are hiring are of good quality and they're the right candidates. So whatever we do online is being monitored today, and there are tools to monitor your presence and activities online. There are hundreds of tools which are available. If you want to know more about these tools, one of the easiest thing is to do is to watch that movie called Social Dilemma. How many of you watched that movie, Social Dilemma? Type me if you have watched that movie. Type N if you have not. No, Ambika, no. Okay, no. Please watch that movie. It's called Social Dilemma, and it will give you a clear picture of how the data or the information that we submit on these social media platforms is used. It's a wonderful movie, and I always talk about that movie whenever I talk about online tools. So use that movie. It was released during the pandemic, I think 2020. It's called a Social Dilemma. I'll also put in the chat box. Just make a note of that. And if you get a chance to watch that movie, please watch that movie. Social Dilemma. Okay. Do watch that movie because it gives some of the very insightful options, or it provokes your thoughts as to how the social media can be misused. Okay. And I'm sure after watching that, you'll be a more responsible person when it comes to the use of social media. So Facebook, yes, if you like Facebook as a tool, please use it for your professional growth and personal connections, both of them. LinkedIn is a wonderful tool, and more than 740 million people are right now using LinkedIn as a platform. Use that platform and connect with right people. So if you want to get into formulation and development, if you want to get into regulatory affairs, if you want to get into medical affairs, whatever domain you want to get in, you want to go for higher studies, connect with people who are resonating your a future skill, future profile. So connect with those people, and if you surround with right people, you will be a better version, definitely, right? So please be online on LinkedIn and use it at least for 15 to 20 minutes every day. Why every day? Because otherwise you lose track. Okay, billions of updates happen every single day, and if you are losing track, then it is not right, specifically for your domain, right? Twitter is good if you are very, very active, and if you are not active, then don't join Twitter. I don't suggest, but I would suggest you to be on LinkedIn. Instagram is a great tool. Again, many people have got job through Instagram, but then I don't know about much about, I don't have a real cases with respect to pharmacy, so I cannot talk about that. So, but I know for sure that LinkedIn has helped many people to get jobs, and there are more than hundreds of other platforms which are available today. There are specific tools with respect to career. There are specific tools with respect to social media. There are 130 plus social media platforms which are available. Some of them are used in India, some of them are used in other countries. But these four, Facebook, LinkedIn, Twitter, and Instagram, are the four major platforms that are used by almost all of us, right? So LinkedIn is the best platform right now. I would suggest to go for it. And then if you want to build your reputation, build your online presence, build your own brand, then LinkedIn is one of the best platforms. Going for higher studies, connect with right people on LinkedIn. Going for job opportunities, connect with on LinkedIn and look out for those opportunities. So that was it, and now we can take up some questions. Thank you so much for being with me, and I hope it was able to clear some thoughts for you, create some thoughts in your mind. And I hope these are some of the skills which you learned during your B.Pharm, M.Pharm, or PhD. And any of these skills, specifically with respect to digital skills, if you are stuck somewhere, then I'll be more than happy to connect and help you out. Okay, not just in helping you out with respect to digital skills, but also helping you to connect with recruiters across India and universities across globe. So thank you so much for your patient hearing. And in case you have any questions, don't hesitate. Please fill in that form that I've already given. Yes, I'll share the link to the question one more time, and then we can take up some questions. So here is the link to the question. Please use this. This is the link to the questions. You can ask the questions directly, and I'll try to answer whatever best I can. Okay, so let's see if I'm getting some questions. I'm just checking. Just give me one moment. Yes. Okay, so Surya Prakash, the question from Surya Prakash is, please tell me more about regulatory affairs which are available for students. So Surya, please watch that, I had done 2 webinars on this topic of drug regulatory affairs. They're available on my YouTube channel. It gives everything about drug regulatory affairs. What are the career opportunities? What are the qualifications? Everything, okay? So please watch that video. I'll see if I can pull out that link for you in the chat box. Just give me a moment. I'm on the YouTube right now. Just let me try that. I'll just see if I can send you the link. Okay. Okay. Feedback link. Yes, I'll send that as well. This is the feedback link. Please share your feedback so that we know if you are on the right track. Okay, so next question is from, just a moment. Here we go. Okay, so Rohit, सर आप सर मैं अब बी फार्म फाइनल ईयर में हूँ, कॉलेज से निकलने वाला हूँ, 4 months लेफ्ट. ओके, क्या क्या स्किल सीखना है? सो रोहित, और जो भी मैंने स्किल्स आपको बताया अभी, 5, 6, 7 स्किल्स है, वो आपको सीखना पड़ेगा. लीडरशिप, कम्युनिकेशन स्किल्स, ओके, ईमेल राइटिंग, resume building, all these skills you have to learn. Okay, so learn those skills. They are very, very important for your future career. Okay, so 5th year D Pharm. Okay, 5th year Pharm D, CSIR exam. Okay, so you can get that details on Google, and if you want, I'll forward that for you. Current pharmacy future job related opportunity. This is a question from others. So others, there are 20 plus career opportunities that we have discussed on the YouTube. You can check that and then you can prepare accordingly. Okay, so that's all about the questions. We didn't receive any other questions. So I hope it was not boring. It was, some informative session for you. Dr. Jay, you are here. What do you feel about that?
Hi, Manoj. Excellent presentation. Actually, I learned some tips from you today. It was a wonderful session. I think this is one of the important sessions that our school graduates have to learn. When I was back in India, when I was graduating from Madurai, I had no idea of any part of communication skill, teamwork, time management, self-management. None of that were taught. For me, it was all self-learning. Now, at least these students should be lucky that they got the online media like that, every information at your fingertip.
Yeah.
For example, Adarsh asked me some topic. Like you said, he can choose a topic and then he can Google it. Just Googling itself is going to give you all the information.
Absolutely.
A lot of different, reference points and some of the things you mentioned, MIMS and PubMed and UpToDate.com. So everything is at your fingertip. All you got to know is to where to look for it. And I think you gave them the right direction, and I appreciate that very much. And you mentioned be assertive. Be assertive sometimes may be misconstrued as being that what I'm saying is right. You got to listen to me. It's not that. It's simply other way of saying that I said. It's displaying confidence with competence. At the same time, if it doesn't go through, you should have the skill set again to accept the word no for an answer as well. Because sometimes it is difficult to come across when the person has close-mindedness. So we got to open our mind and listen, because there is some reason behind it. There may be some logic behind it. If there is nothing there, there's very little we can do about it. So that's what I believe assertiveness is. Because sometimes we may be absolutely right, but still we can force it through someone, right?
Absolutely.
Yes. Not have an open mind. So those kinds of situations you will encounter, especially when you speak with the physicians. Because still we have some here in this country.
Yeah.
That some of the old timers, right? And new generation is very open-minded, but older generation is still, they have that complex issue that you have to penetrate through. So all in all, it was a great session, Manoj. I learned something, appreciate it. And I got to learn some of the digital techniques from you as well. And I'm looking forward to it. Thank you so much.
Thank you. Thank you so much, sir. Thank you, sir. Thank you. So Masira has a question. How can we express our opinion without being aggressive? She says, unless we are a bit ignorant, nobody listens to us. So Jay sir, you want to answer that, or should I give my thoughts?
Aggressiveness is not a good attribute at all. For example, I will give you an example that I encountered. Excuse me. We have a doctor on the floor. I don't want to mention the name or the patient's name. And I was reviewing the medication list. And one of the medication was baclofen, you might have come across. It's a muscle relaxant, baclofen. And that patient was taking, I believe, if I remember correct, 20 milligram every 3 hours. That was extremely high dose. Baclofen, if you Google it and look at the dose, usually is 10 or 20 milligram, probably 3 or 4 times a day, not every 3 hours. And I happened to see the doctor on the floor, and I talked to him. Hello, doctor, how are you doing? I was just looking through the profile, and it appears this patient has been taking a very big dose. And as you know, baclofen can have other side effects as well. And when you want to stop it, it is difficult to stop it. There'll be some rebound reaction to that. You're all aware of that. You know what he said? He said, Jay, that's what he's taking all these days. He has got a very big chronic back pain. He's used to that. So don't worry about it, okay? So that's what he said. I said, no, I just wanted to bring to your attention, doctor. It's my responsibility role. And you're aware of that, and you know the situations, and I leave it up to you. Then I went and documented in the computer. I could be much more aggressive. No, the dose is double the maximum dose. Patient could be harmed. And you got to take a look at it and change it. That's being aggressive, right? There's no need for that. You have given your information gently, politely, at the same time firmly. That's all we need to do. He doesn't take it. It's difficult. You can take the horse to the water. It is difficult for the horse to make them drink. Can you? That's the situation there. Yeah. What I did, I provided the information, went back and documented that in my computer. Patient was on baclofen and on 20 milligram every 3 hours, extremely high dose. Doctor was notified to reduce the dose, but the recommendation was declined. You know what happened that night? That night, patient died. The patient actually passed away. I'm not sure it's because of baclofen. He had other medical conditions, a lot of other issues, maybe some angina pectoris, ended up in myocardial infarction. I don't know. I can't recall as to the reason for his death, but the patient died. And next day morning, when I was on the floor, the doctor came running, coming to me. Hey, Jay, you told me that dose. Did you make any notation in your computer? He wanted to know whether it is being documented. I said, yes, doctor, I did that. I did document that. Then I asked him, what is the reason you're coming to me for this? The patient died. I said, oh my God. I didn't want to, dig deep into as to the reason to the death of the patient, but that's what happened. From next time onwards, he will come to me and ask for opinion. Absolutely. He will come to me, ask for some other medical treatment. He will come to me and say, Jay, this patient has this infection, would you dose it? So things totally changed. So the aggressiveness is, in my opinion, is not a good recommendation. Unless you know for sure patient is going to die, then you can probably a little more assertive, a little more firm in your response, or you can even escalate your call to the higher authority. You can go to the medical director, or if there's an in charge in the department, You can go and express your information to them, explain to them. There's no need to be aggressive at all. And I'm telling you, don't be aggressive. I was a very aggressive guy myself, coming from India, from Southern India, big family. I was extremely aggressive. Then I learned as the years go by that that's not a good approach if you want to make a good impression. And at this age, I know, I have experience enough to know that aggressiveness is never going to be helpful, not only in your professional life, in your personal life as well, as Manoj pointed out, personal life communication, professional life communication. It's applicable in any walks of your life. That's what I like to say. This age, I wish someone was telling all this information when I was 25 or 30. I don't think I had the opportunity for that.
Totally
That
agree.
would be my little input, 2 cents on that question, Manoj.
Totally agree with you, sir. And in one sentence, if I have to tell you, Masira, if you are here, if you are there to hear, if you're hearing us, don't react, respond. Okay. So whenever you have this, problem, whether you want to be, whether you want to be assertive or aggressive, just think for a moment and respond. Don't react. The moment you start reacting to the situation, you always become aggressive, right? If you start responding, you will be assertive. As simple as that. So thank you, Jay sir, for your note. And I think I have a couple of questions. I have 2 questions. Nehal sir, I'll take the 2 questions and then I'll pass on over to you. Nehal sir, I think he's... So I'll just take 2 more questions, sir.
Okay, sir. Okay, no issue.
Thank you, sir. 2 more questions. One is from Vaishnavi. She says, is it necessary to focus on research and review for doing M-Pharmacy career? Vaishnavi, absolutely yes. Without doing the research, how many of you have come to pharmacy by choice and how many by chance? Think about it. So for all of you who are, present on Zoom, just type by choice or chance. Choice or chance. How many of you have joined pharmacy by choice? Choice or chance? So Chinju says choice. Okay. Rajendra, chance. Masira, choice. Okay. Only three of the responses. Sarthak, choice. Okay. Jay sir, accident. Amulya, choice. Rohit, choice. Okay, so in my opinion, most of us join by chance, not by choice. And as Jay sir told, it is by accident also many a times. In my case, it was by accident again. It was not a choice. So most of us join by chance, and we have not done our enough research. So similarly, when we are graduating or doing masters, we want to just go for a job which can give us a more salary. It's not right, because we don't know whether we'll be able to justify ourselves in that domain or not, right? So I've seen so many pharmacy people, they just join some domain, and after working for 3-4 months, 5 months, they realize that that domain is not for them. They want to switch over to another career, another path, and then they become considered as a fresher, right? So this just continues for a few years, and then by that time they'll be totally confused and they'll be start blaming pharmacy as a profession, right? So this is not right. So if you want to do a pre-informed decision, you want to take a right choice, the best thing is to do a research. And the research is not on somebody else, but yourself, right? Because you are the right person to decide about you, nobody else. I don't know what Ambika wants. I don't know what Chaser wants, right? I just know what I want with my life, with my future. So I can decide only about my future. I'll be the right person to decide my future. So I have to do my own research personally. I always suggest this, do a personal SWOT analysis. So if you go and Google personal SWOT analysis, you'll get all the details. There are hundreds of articles on that. Please work on yourself. Do a SWOT analysis, understand yourself, understand your strengths, your weaknesses, and then do a research on the strengths that you have and the kind of career opportunities that your strength has to offer you, right? And then go in for that kind of job. This is the easiest way to be a satisfied, pharmacy professional, a good pharmacy professional. That is the easiest way. Okay, so Guru says, thank you, Vaishnavi, for asking that question. And, this is very, very important to do your research on yourself. Guru says, I'm currently in 4th B Pharm. I do not have a particular goal as such, what to do for the PG subject. I'm interested in the management and pharmacology, but I want to get into the stream where I can earn more and live a good life. I'm not able to find my passion where I truly want to go. Could you help me in this? So Guru, this is, thank you for asking that question. And I'm sure, 70 to 80% of the people who attend sessions, they'll have this question in mind, but they'll not ask. Okay. This is a very, very burning question for all of us, and we do not know what to do in our lives. So again, as I told earlier, we have to do a personal SWOT analysis, understand what are our strengths, what are our weaknesses. See, all our weaknesses can be converted to strength by, learning the right skills and, knowledge. And by doing that, you are doing a research on yourself and you're not comparing yourself with others, right? And once you do that, you become the right fit for any domain, right? Because you have done your own research, right? You're satisfied because you're not faking, you don't have to prove to somebody else, right? You have done that research and now you are fit for that organization. Just apply for it. So there is one more last question. Istaq Khan, how to write a review paper and publish? So Istaq, I'll not take that question here because this is not relevant. I do a separate session and workshops on that. So please do connect. You can also watch some videos on my channel. We have done a couple of sessions on that. So that is again a question, good question. Thank you for that. So thank you, Nehal sir. Thank you, Ambika, for all the work that you have done. Thank you so much, Jay sir, for with us. And I'll pass on to Nehal sir or Ambika or the team. So, and take it from there. And a round of appreciation for Ambika for, connecting all of us together and helping us do this webinar for the benefit of everyone. And I'm sure, I'm hopeful, I'm confident that at least some key takeaway points you could get from this webinar. And all of you who are with us till the end of the webinar, Ambika will send you the recorded version as well. So please do watch at your convenience and don't hesitate. In pharmacy, one of the major problem is we hesitate. We have some kind of fear to ask questions. We think that, okay, probably this is the stupidest question, right, I'm asking. So please don't have that fear. Even if you have the stupidest question, please ask, because you never know, your question can change the life of somebody else. Somebody else might have that question, and that answer, the right question, the answer to that question might change the life of somebody else. So please do ask question, connect with the right people, and we are there to support you whatever ways we can. Thank you so much, Nehal sir, Ambika, and Jay sir, and all the participants for spending so much time with us. And I'm hopeful that we'll can do more such webinars and sessions for the benefit of pharmacy as a whole. So thank you again, and thank you so much.
Thank you, Manoj sir. Thank you, Jay sir, for sparing valuable time and motivating the students of Pharm D and B Pharm and all the other delegates who have joined from the different areas. Thank you, sir, once again.
Thank you so much, sir. Thank you so much, sir.
Amikanand, it's over to you.
Yes, sir. Yes, sir. Nahid.
Thanks, everybody. I appreciate the opportunity.
Bridging the gap scale to learn during college for successful career.
Yeah.
Now I would like to invite Ambika Jha for proposing the word of thanks.
Good afternoon, all. I know I am a stand between you and your lunch, but before I let you go, I will complete my responsibility. It's my privilege to offer a vote of thanks on the occasion of Pharma Philia virtual conference. I would like to thank today's speaker, Dr. Pillai sir, Manoj sir, for delivering the lecture. Now I have to acknowledge institutional contribution. Particularly, my heartful thanks goes to our principal, Dr. Nehal sir, for giving the permission to organize such events, such type of events. A special thanks goes to Dr. Akshay sir for guiding and their support throughout the events. And last but not least, I am very thankful to all the participants for giving their contribution and valuable time. Thank you all.
Thank you so much. Thank you. So maybe we'll issue a letter of appreciation to Ambika at some point of time from the college or from our institutes or whatever. I'm sure
college
this
also will issue.
Yeah,
From college
perfect.
also we will issue it.
Thank you, sir. Thank you, sir. Because see, what happens is these, these letters actually they boost the confidence of students. Number one, and
Yeah.
number two, they help the industries know that okay, such a student has done such job. So he has the traits of leadership, communication, and connecting, teamwork, right? So it helps a lot. Whether this letter, no industry will consider probably, but then it will give a morale boost to the student. Number one. And it will help the industry to understand that okay, such a student can do so many things, right? So please do that, and we'll be more than happy to reconnect back and do some more learnings. And if we are doing a practical learning session where the students want to bring their laptops and learn, then I'll be more than happy to do like research publications, social media management, use of LinkedIn and all these things. And Jay sir, anything related to clinical practice, clinical pharmacy, yes, we are there. So thank you so much, Ambika. I see one more smiling face next to you. I don't know the name. So.
Parth, sir.
Parth, hi Parth. Thank you for supporting Ambika, and it's a good teamwork for sure. Thank you.
Thank you, sir. Thank you, one and all.
Thank you so much.
Thank you.
So, Sir Nehal, sir, with your permission, could we end the session, or if you have any?
Yes, sir.
Perfect.
Thank you once again. Thank you once again. Thank you,
so much.
Just State Pharmacy Council also for sponsoring this event.
Excellent.
Thank you, sir.
Excellent, sir. Thank you so much.
Thank you sparing your time, sir.
Pleasure, sir.
Nice to see you on virtual.
Thank you, sir.
Thank you.
Thank you.